Well, today is World Mental Health Day, and this morning we're going to talk about a push to increase access to long-term mental health care.
So there is a bill aimed to honor Michelle Alyssa Go. She was tragically pushed to her death in front of a subway train at the Times Square station back in 2022. Joining us now to talk about the Michelle Go Act are Congressman Dan Goldman, who represents parts of Manhattan and Brooklyn, and Congresswoman Nicole Malliotakis, who represents Staten Island parts of Brooklyn. And I love the fact that two of you are coming together. We need more of this. So how did this come about?
You could start.
I introduced this bill, or I at least was working on this bill at the beginning of the first term, and I know that Nicole has expressed concerns about the mental health crisis that we're seeing in this city. And I went to her and I said, look, we need to do something about this, and this is one way. It's not a silver bullet, but there's one way of dealing with the mental health crisis that has gotten so much worse since the pandemic. And she was agreed, and so we worked together on this bill and introduced it.
So what would this bill do exactly?
Well, it increases Medicaid funding for not institutions, but hospital beds, right? So right now the cap is at 16. This would allow facilities to be reimbursed for up to 36 beds, which would help these facilities expand their capacity. We have an issue here in New York where we have about 18 beds for a population of 100,000, and that's basically mirroring what it is on the federal level. It really should be 50 beds for every 100,000. And over the past few years, we've seen some state beds close, and that's why we're seeing more people on the streets. And so our bill would address a need. It would fill this gap, and it would actually help in other ways. And it would, I think, at the end, pay for itself, because right now people are going through this revolving door. They go through the criminal justice system. They get released right back onto the street. Many are homeless, or they go to an emergency room. These are costly expenditures. If we get them the long-term care that they need, it will save taxpayers money, it will protect lives, and it will help prevent issues like we saw or we see on the trains continue. And Michelle Go is not the last. That's the sad part of this. This is an ongoing issue. We could save lives.
Congressman Goldman, obviously this is something that we here in New York see firsthand, but you need national, federal legislation to change, which means you got to get other support from other Congresspeople. What has been the reception you've seen so far?
Broadly, the reception's been quite good. We have co-sponsors on the proper committee, both one Republican, one Democrat, and then we have a number of other co-sponsors. The reality is mental health is an issue that impacts the entire country. And as you saw with the Bipartisan Safer Communities Act, the gun legislation that was passed in the last term, a big portion of that was to go toward mental health treatment. This is something where Republicans and Democrats agree, and we're hoping that we can push it over the finish line and really provide that much-needed care to people who want it but cannot get it. And it's an equity issue, too. If you have money, you can pay for mental health care. If you don't, you cannot get access to it.
If this doesn't pass nationally, is there anything you can do specifically to try and help New York?
Well, we could see how other ways that we can help New York. There are things that could be done at the city and the state level. I think that we need to utilize Kendra's law more.
Explain that.
Kendra's law would require, it's involuntary inpatient treatment, and the issue with Kendra's law is too many people, as I said, get arrested, they get released back onto the street. We need to help these jails complete paperwork on behalf of people who don't have families to do it for them. Same thing with hospitals. We need to encourage hospitals to fill out this paperwork to get people the care. Basically, it would be court-mandated treatment, and that would be a much better alternative than just releasing somebody back onto the streets, because we know on the subway system alone, 50% of the attacks against MTA staff are people who are mentally ill. About a quarter of the major felonies that are committed in our city, assaults and rapes and terrible things that we've been seeing, are committed by people who are, at least from the arrested population, the ones who are arrested are committed by people who are mentally ill.
So underground, above ground, we're seeing record amount of mentally ill on the street. The other day, my sister-in-law, broad daylight, 57th and Park, some guy throwing rocks at people on the street. Okay. He's got to be mentally ill. Who does that, right? So what do you do? Because these hospitals put them in a room for a few days and they're back out again.
That's why you need wraparound services. So this is one part of it. In the last budget, the governor put $1 billion into mental health treatment, and part of that is to go into the community, into community care centers, which help people transition
But where
from
do we
that
keep
long-term.
them? Because the hospitals are at capacity. So where do we keep them? They don't want to keep them that long.
We need more beds, Rosanna.
And we need supportive housing, right? There's too much of a focus on putting shelters all over the city of New York when we actually need supportive housing that will provide those services, whether it be drug addiction or mental health, helping people transition to a job so they could be self-sustaining. I would like to see the city focus less on popping up shelters all across our city and focus more on building supportive housing that kind of encompasses all the needs of the individual.
As you said, just arresting people and putting them back out on the streets does not solve the issue. You need more beds for treatment. Before we let you go, obviously, Hurricane Milton, right on the heels of Hurricane Helene, taking everyone's attention. You know, there's been this whole thing about FEMA and their funding. Do you think that Congress, you're in recess right now, will be called back at all to provide emergency funding or at least look at it before the election?
I signed a letter yesterday with 63 of my colleagues urging the Speaker to bring us back. These are two of the worst storms in a 1 week span that we've ever had here. And as we know, it's always a struggle to fund FEMA. My friend Nicole and her colleagues generally don't like to until their states need it. But we're going to have to address it. Whether we need to do that before the election or after remains to be seen.
You know people in our area with Hurricane Sandy. They haven't even gotten there. Some of them haven't even gotten FEMA money. So we know how FEMA works.
We know more. Unfortunately, Staten Island knows. They were really hard hit by Hurricane Sandy. Right before we left, 2 days before the hurricane had hit, we did approve $20 billion for FEMA, and that's important, and it's there. And I would argue that we shouldn't have been spending billions of dollars on migrant encampments, on sending people all around the country who are not citizens and entered our country the wrong way. So I would make that argument as well. But certainly I agree with my colleague that we should go to Washington if there's more funds that are needed. I would like to see them use the $20 billion that we just gave them, and then let's assess the situation and get down there and do whatever we can. And by the way, Staten Island elected officials, we have a collection right now, and you can go to any of our Facebook pages and see the items that are being collected, because we're working with the International Firefighters Association and Staten Island Borough President Vito Fossella to do a collection to send to North Carolina.
But just to be clear,
Yeah.
the funding is totally separate streams. Whatever was for
It's all
immigration, which
FEMA
is
funding,
about,
though.
it's about $1 billion.
But they do come out of two different pockets. Before,
And most
we
of it
brought
has
here
gone to
out of
Texas.
love. We were brought here out of love and bipartisanship. So let's end it that way. Okay? We'll agree to disagree right now on that topic.
We want more of this,
On that
by the way.
topic. All right.
That's
As
good.
do we.
Glad we
As
found
do
something
we.
to agree on today.
Yeah, exactly. Thank you so much, both of you, for joining us. And good luck with the Michelle Go bill. We all definitely could use it.
Congressman Dan Goldman, Congresswoman Nicole Malliotakis. Appreciate it.